Hello, good evening. I am Dr. Srinagesh. I am a plastic and cosmetic surgeon working in Hyderabad. We've got a clinic called Ojas Aesthetic and situated at Madhapur. And we've been concentrating mainly focusing on lipedema for the last couple of years, in addition to the other cosmetic and plastic surgery works. And I have had my basic education from Orissa, and then afterwards went on to Chennai and did my post graduation at Chennai Madras Medical College, and then subsequently I had been to Germany to learn about lipedema, and I've taken training there. And now, with that knowledge, for the last couple of years, I've been practicing in Hyderabad. And we have also been trying to spread the awareness about lipedema, because lipedema is a very poorly understood disease, which commonly occurs in women. Approximately around 11% of the women globally are affected by lipedema. And so now most people are confused about what lipedema is. It's wrongly been diagnosed, wrongly treated by many doctors, physicians across the globe because of this particular kind of confusion. And as lipedema is not taught in the medical schools and colleges as of now yet, so this particular condition and this problem about this wrong diagnosis or is persisting and is going to be there for a little while. Now, with a lot of doctors across the globe who are trying to spread awareness and lead the people in the right direction are increasing. So soon, I think lipedema will be recognized, and the other and doctors also will take over, and it becomes more accessible for most of the women across the globe. So now, having mentioned all these things, now you must be wondering, what is this lipedema, and how is it different from different conditions. So lipedema, if you look at it, there's a classic features of lipedema is having a narrow waistline, the body structure, the chest, the face, neck, chest, and the abdomen is quite narrow, and then the hips start to increase abnormally in size. There's a large volume of thighs and even the legs in many cases, and around 30% of the women across who have this lipedema also have their arms and forearms affected. Now, this is a classic feature. There is an abnormal deposition of fat in these areas, and it is progressive in nature. Usually, it is seen to start somewhere around puberty. It could start somewhere around pregnancy or even during menopause. But these are the other times when the lipedema can flare up and progressively increase quite dramatically. Other condition where lipedema starts is when the woman usually has some kind of a gynecological surgeries like a tubectomy or even hysterectomy, or these kind of surgeries. These are the times whenever there's a shift in the hormonal levels in the body, lipedema can be triggered. Now, a typical patient with lipedema will have a very slim waistline, but then as you go down, the hips and the thighs are quite large, so they don't fit into regular trendy clothes. If a lady has to go shopping, she finds that she fits into a small size top, but when she goes for her trousers or the dress which drapes the lower half of the body, you find she might find she needs a XL or a double XL as well. So, and this puts off the woman, and they do not appreciate this. Everybody likes to be in a small from top to the bottom, or M from top to the bottom. Nobody likes to be so disproportionate. And next is this particular fatty deposits in the hips, thighs, legs, or the arms. They as the stage progresses, you find that the fat initially, which is smooth, starts to become nodular. There is a rice grain like structure, or a pea size nodular structure, or sometimes even larger, a lime size or a walnut size swellings, irregular swellings. And many times they think that it is nothing but cellulite. So there's a big difference between cellulite and lipedema, and many times it is confused to be cellulite. So this particular swelling is bilaterally symmetrical, and as the size of the area starts to increase, there will be a lot of stretch marks. There's a loss of elasticity of the skin, and there would be skin folds that are developing. And sometimes these particular areas, the hips, the thighs, the buttocks, the legs, or even the arms, they can become quite painful, tender, painful, for no reason at all. And regular medications and all may give temporary relief, but they don't get much relief. So, and these ladies, as the day progresses, they tend to become tired, they fatigue very easily, and they lose interest in whatever they're doing. Another characteristic feature of lipedema is bruising. They, on a very small little trauma, which the patient, normal individuals don't even consider it to be an injury or a trauma. It just hits them, and they tend to bruise. A bluish or a reddish patch develops, and it's only almost a day after they realize that oh yes, they recollect, I did get an injury, and I hit myself somewhere, and then got this particular bruise, and it takes approximately around 3 to 4 weeks for it to disappear. Another feature of this particular lipedema is, wherever there are these abnormal deposits of fat, you tend to find a web-like structure of veins. These are called spider veins, and these spider veins are the precursor for reticular veins and varicose veins. So if they're not addressed properly, the fat is not addressed on time, then this subsequently will lead to reticular veins and subsequently varicose veins. Why does all this? And in addition to this, there is a weakness of the lymphatic system, and there is kinking of the lymphatic system, leading to deposition, leakage of the lymph fluid into the surrounding tissues, and it soaks the fat and other structures, it bathes it, and the fat becomes quite edematous and swollen. And this could be one of those areas where which actually is a triggering factor for the disease, the nodularity and the irresponsive behavior. Now, the progressive deposition of fat, increases the weight in that particular area. And when this happens, and the fat deposits around the vein or the lymphatic system, there is kinking, or there could be a stretch of the vessel. So the tubular structure starts to expand. And as we all know that veins are those blood vessels which take the blood back into the heart, back to the heart for during the process of recycling, so the circulatory system. So these veins contain valves, and when the vein stretches, the wall which is there tends to spread out and it becomes incompetent, and blood tends to flow backwards. And this particular situation, when it is uh, prolonged and stays for a pretty long time, it leads to varicosities and varicose veins, and then subsequently the patient can get varicose ulcers and other complications of varicose veins. Similarly, as the stage as the fat keeps on depositing in these areas, and there's kinking of the lymphatic system. The lymphatic systems are like fine threads, which are a network of threads which carry the lymphatic fluid through the lymph nodes back into the circulation. When these when fat gets deposited around that, and the weight of the fat causes kinking of the lymphatics, so the lymphatics get choked, and they don't function well. So it is imperative that this diseased fat, or this abnormal amount of deposition of fat, be removed from the area, so that these veins, lymphatics, and other structures do function better. Another thing about this particular condition is that when there is this abnormal deposit of fat, what happens is the center of gravity, the alignment of the body starts to change, and the knee joints tend to bend away from each, the legs tend to bend away from each other, causing knock knees. And this particular condition can lead to degeneration of the joints of the knees, as well as, because of that overpronation of the ankles, there could be a flat foot developing also. So this early degeneration of the knee joints leads to arthritis, and leads to the patient to have severe pain in the knee joints, forcing the patient to go for a knee replacement surgery. So if lipedema is diagnosed early, the lipedema fat is addressed by manual lymphatic drainage, or by compression garments, or using the lymphatic pump, or removal of the excess amount of fat, which is the best treatment as of now. It is then that some of these conditions can be reversed, and the patient can lead a near normal life. Now, things associated with this are obesity. Patients suffering from lipedema can also have obesity in conjunction. So, because when you are not able to do a proper exercise, you become relatively immobile. The mobility is affected quite badly. Then you tend to put on more weight, and when you start putting on more weight, there is always a possibility that you start putting on weight around your waistline, or in your chest, abdomen, back, and other areas, leading to obesity. Fortunately or unfortunately, patients suffering from a typical lipedema are protected from diabetes until late in the disease. So initially, patients may be having well, quite a large hips, large thighs. They could be overweight. The weight is progressing, but they are protected from having diabetes. Generally, obesity is linked to diabetes, but lipedema, you are protected from diabetes. So to a reasonable stage. So these are all some of the features of lipedema, and it is wise to understand it, learn about it, and find a person who can help you with treatment of lipedema, to avoid long-term complications. If neglected, this particular condition can go to stage 4, that is the stage 1, 2, 3, 4. So if you go to stage 4, it becomes frank lymphedema, that is something like elephant legs, and then after it becomes extremely difficult to manage these people. At the time the lymphatic fluid gets deposited, it sort of forms a coagulum sort of a thing, and the skin and other structures become quite hard, and they become quite irresponsive to treatment. So rather than going so far and suffering and becoming immobile and restricted with restricted movements and other things, it is always better to get diagnosed early and treat early. If a patient goes for a treatment in stage 2 or stage 3, stage 1 is even better, but if they go for treatment in stage 2 or stage 3, there is a possibility that they stay there, or they could reverse themselves from stage 3 to stage 2, or from stage 2 to stage 1, or stage 3 to stage 1, and lead a near normal life for a pretty long period. Also, it's lipedema is a connective tissue disorder, so almost all parts, all structures of the body do get affected. So many of these patients have Ehlers-Danlos syndrome kind of a situation, where there could be hyperflexible joints or hypermobile joints. So these people who have this particular thing, because the ligaments are a little relaxed and loose. So that particular thing, they think that they're more mobile and more flexible, but in fact that could lax ligaments can lead to frequent dislocations, and that can cause again damage to the joints. So one who is having lipedema should not try to overexert and overstretch, over flex themselves, and end up in trouble. So there are certain things which precautions that one needs to take, so that one can lead a near normal life. You can always contact us at www.ojasaesthetic.com or www.lipedema.in, or visit us at Ojas Aesthetic, Madhapur, Hyderabad. Thank you.